it is the toxicity here, the length of this process, it depends on how much it took you to get up here, time-wise. So basically, I want you, it could be to know that it could be caused by improper diet, eating food that was not made for you. Think of you own a Mercedes, and this is a car that they say that should run very well and does not break down. But if you wake up one morning and you say, geez, every day I go to the gas station and gas up my car with gasoline, this time I'm going to put diesel in it. How far is this car going to take you? Not far, would it? So the whole idea is that if you feed your body the wrong food, you're not going to get too far. And you're going to have a lot of problems in your life. What causes the toxicity is medication. The more medication you take, later on you will see that those patients who take medication for heart disease, this medication itself starts to lead to cancer problems, which I will show you in a few minutes. So basically taking medications is not an answer to all your problem. It is an answer to carry me today. It's a stepping stone from today until tomorrow. But tomorrow I should find a solution to stop taking whatever I'm taking. Also, the cause of toxicity in the body is smoking or toxic lifestyle, drinking and doing all those wonderful things. And also there are the environmental factors. Environmental factors means that you are you are living in an area that you cannot help. Years ago I used to come to Cornwall and I used to go down to the lake just for a little walk. I couldn't walk there. Do you know why? It's changed, isn't it? I can go today and go for a walk. So basically, if that smell, it's toxic. It wasn't a factory there? Paper mill. Okay, so this is the whole thing, that these things come into our system, carried in molecules. Any smell is a molecule, okay, floating in the air. So when we smell it, it goes inside our body, and the excess of it may lead to problems later on. So this is toxicity. If we are going to really watch out, is we have to not give ourselves any excuses for having these factors in our life. If you are toxic, and people say to you, oh, it takes you years to do it, or sometimes you go to a therapist or to some doctor and say, oh, it takes you 2 weeks, I'll fix you up. No such thing. If you do it properly, it takes you approximately 9 months if you listen, from 7 to 9 months if you listen to your doctor and do it right, which means you eat well, start to do things right, and find no excuses. Okay? On the other hand, let's look at this. Toxicity. Now, a person who drinks, a lot of people come to me, they say, oh, during my first examination, I ask patients about coffee, alcohol, smoking, all the good stuff that they have. And I ask about alcohol. A lot of people say, oh, only 1 drink a day. Oh, I must have it with supper. Let's say wine. But sometimes, if you have a yeast infection, you should not touch wine. And people say, oh, come on, how can I eat if I don't have wine? Well, I can eat without wine, so you can eat without wine. So basically, if you are drinking alcohol, you are losing B1, you are losing B6 and B12. You may say to yourself, why don't you speak to me in a language I understand? So what if I lose B1, B6? I will show you later what does this mean. Also, you lose the folic acid, especially for pregnant women. Should not lose this folic acid. You will be losing vitamin A, calcium, magnesium. How many of you have leg cramps at night? Leg cramps at night has to do with this. It's not growing pain. You're grown up already, aren't you? And I have seen at least 2,000-3,000 children who came to me and they were diagnosed with something called growing pain. I didn't know that if you grow, you have to pay a penalty for it. So basically, you give your child or yourself calcium, magnesium, good product, and that growing pain will disappear within a week. Okay, because it's shortage of calcium, your muscles are not interacting together very well. Also, you lose zinc. For males, you shouldn't lose zinc. Your prostate will not be happy. Your sexual activity will not be happy. So your husband is not performing well. Dump him with some zinc. Antacid, a lot of people use it. And antacid takes away vitamin D. What is vitamin D is important for?
Calcium absorption.
Thank you very much. Your body cannot absorb this calcium if you don't have vitamin D. So if you don't have vitamin D, if you are using antacid, you don't have vitamin D. You cannot absorb calcium, magnesium. And one of the most important factors for your stomach to not have acidic problem or heartburn is to have enough minerals such as calcium, magnesium, and chlorine. So basically, it's a vicious cycle. You're hooked on taking this for life. You see it that way? It's taking away vitamin D and taking calcium from you. So you'll have antacid problem all your life. And please realize that if you keep erupting acid in your esophagus, this person may, and remember the word may, develop esophageal cancer later on because of the effect of acidity. Aspirin here, it makes you lose folic acid, makes you lose potassium, and if you keep using aspirin for a long time and you become deficient of potassium, your body is going to, your heart is going to race later on. You will find that your heart is really running fast, and you start getting traffic tickets for this. You know why? Because of potassium, potassium deficient, and vitamin C. Okay? Again, if you take laxatives, laxatives makes you lose minerals. It's the worst thing you can do to yourself by taking laxatives. If you're going to do anything for laxative, if you don't want to go to a doctor, if you don't like doctors, and you decide to treat yourself, you take vitamin C for laxative instead of taking actual laxative, because you lose a lot of minerals from your stomach. And we have something called gastrointestinal cycle. Gastrointestinal cycle means that the enzymes and the minerals and the calcium, magnesium, and the acid that dumped into your stomach, after the digestion is done, they go into your intestine and got reabsorbed back into your stomach lining. If you take laxative, you break that cycle and you lose those minerals, and eventually you're going to have a lot of problems. So basically, laxative is something I frown upon, and I tell my patients not to touch laxatives because they are very bad. And methotrexate, for those people who are using methotrexate for methotrexate is a sledgehammer. Did you know that? You know what's methotrexate?
No.
Well, methotrexate is used in cancer. It is used also for people who have rheumatoid arthritis. It's also given to some people